Hi, I'm Dr. Paul Mason, and today I'm going to talk about the pandemic coronavirus known as COVID-19. Now, some of you may construe what I'm about to say as scaremongering. Well, coronavirus is scary, and there's no resiling away from that. And this here is what all the fuss is about. Believe it or not, a relatively fragile virus. Now, this isn't the first time we've seen a pandemic coronavirus. We had SARS in 2003 and MERS in 2012. And like COVID-19, these both originated in animals. It's likely that COVID-19 was first transmitted to humans by civet cats, which can be found in markets in China. Now, a lot of people are not particularly worried about COVID-19 because most people who catch it will only get a mild illness, about 81% in fact. About 20% will suffer a more serious illness though, and in this group, the risk of death is real. Those with mild illness will most often present with fever and a dry cough, and most mild cases will resolve in a matter of 2 weeks. But if the lungs are seriously affected, things can get messy, because this can lead to pneumonia, which is basically when the lungs become filled with pus and mucus, choking off the supply of oxygen to the body. Victims die of what is known as acute respiratory distress syndrome, with autopsies finding congested lungs with patchy areas of bleeding and necrotic lung tissue. The percentage of sufferers who die is quite honestly unknown. One of the problems in determining the death rate is that many people have symptom-free infections, meaning the true rate of infection is unknown and making it impossible to perfectly calculate mortality. We do have reasonable guides, however, as more data comes to hand. Estimates range from a low of 0.9% based on South Korean data as of the 14th of March to 5.6% or more from this Lancet paper. But whatever data set you use, understand that COVID-19 is at the very least 9 times more lethal than the seasonal flu. These graphs here compare the death rate from seasonal influenza in the US on the left to that from COVID in South Korea on the right. This is not just a normal flu that we're talking about, and anyone who says otherwise is just plain wrong. And one other thing is very clear. Age is a major risk factor and dramatically increases vulnerability. And so too does the presence of other health problems like diabetes and high blood pressure. So if you know somebody over 80, or indeed anyone with a chronic health condition, then you should care about coronavirus, because while you yourself might not be in danger from it, you might pass it along to someone who isn't so lucky. One of the problems is that coronavirus is contagious even before you feel unwell. It takes on average about 5 days after infection and up to 14 days before symptoms begin to show. And in this period, even before the first symptoms have presented, high levels of virus have been detected on throat swabs. Let's look at how this played out in this New England Journal of Medicine case study. This index patient shown here from Shanghai visited Germany for business meetings and subsequently infected patients 1 and 2. As you can see, it took about 4 days from patient 1's initial exposure to develop symptoms, which importantly were only ever very mild. And during the symptom-free period, patient 1 was exposed to 2 other co-workers, who subsequently became patients 3 and 4, and you can clearly see that exposure occurred while patient 1 was totally symptom-free, and neither patient 3 nor 4 attended any of the meetings or had contact with anyone else who attended the meeting. The message: even those with very mild illness can spread this disease, even without knowing it, and it is very, very contagious. The infectivity of a virus is given by what we call the R0, or reproduction value. Basically, an infection will only propagate if each case can pass it along to at least one other person. In other words, an R0 of 1 is the break-even point for infections to remain stable. Less than 1 and it will fade away, more than one and numbers will increase. Seasonal influenza has an R0 value of 1.28, which means that each case will infect on average 1.2 other individuals. Compare this to coronavirus, which has an R0 value of about 3.28. This means that each case will infect on average 3.28 other people. And this is a recipe for an exponential rise in numbers which can quickly overwhelm even the best healthcare system. And we've seen the consequences of this in places like Italy, which despite having an advanced healthcare system, didn't take coronavirus seriously when it had the chance. And this has led to doctors having to make decisions about who gets life-saving treatment and who doesn't, based on things such as age and life expectancy. In other words, battlefield triage, just like in wartime. Person-to-person spread of coronavirus is thought mainly to occur by droplet transmission. If an infected person coughs, sneezes or talks, expelled droplets can infect another person if it makes contact with mucous membranes such as the eyes, nose or mouth. An infection can also occur if a person touches an infected surface and then touches their eyes, nose or mouth. Typically, these droplets do not travel more than about 2 meters or 6 feet, and they probably don't linger in the air. And understanding this route of transmission means we can wield a potent weapon against the spread of coronavirus, and this is self-isolation. If we isolate ourselves from others by at least 2 meters and maintain strict hand hygiene, we can reduce the spread. And reducing the spread will reduce the peak demand for limited medical resources to a much more manageable level, thus saving lives. And the urgency to get these cases under control cannot be overestimated. Here you can see the difference in doubling time for cases in Italy, which has been an unmitigated disaster, and Singapore, which despite being densely populated has managed it very well. Then compare this to both the USA and Australia to see why we're really at the crossroads. For instance, in Australia, we've got about 2,000 ICU beds across the whole country, both public and private systems. And predictably, these numbers will be rapidly ramping up, but there's only so much that can be done in a short period, especially given that each one of these beds requires specialised staff. And also remember that existing ICU beds are not exactly sitting empty. The public hospital system in Australia, responsible for about 3/4 of these beds, is already operating at near capacity. And initial reports suggest that COVID-19 is associated with severe disease that require intensive care in about 5% of proven infections. Current estimates are that between 20 to 60% of the Australian population will likely be infected. And if we take the bottom end of this range, 20%, then this would still see 250,000 patients needing ICU beds. Clearly, 250,000 patients into 2,000 beds doesn't work. And many people in our community are not heeding this message. I posted a message encouraging isolation on Facebook to my local community a couple of days ago, and this was the response I got. And if this is representative of community attitudes to coronavirus, then we're in for one hell of a ride. Let me put it another way. Remember what happened when everybody converged on the toilet paper aisle at the same time? Well, what happens when there's a run on ICU beds instead? Right now, in Australia, there's shortages of gowns, gloves, masks, sanitizer, test kits, and God knows what else. What's going to happen if this thing really gets going? And when it does, it won't be just the old and frail who suffer. It will potentially be all of us. Swamping the healthcare system can make healthcare inaccessible to people of all ages. What happens to the teenager with life-threatening asthma? Or the pregnant mother with preeclampsia? God forbid there is a car accident with a family inside. Are people just going to stop having heart attacks? The reality is that many of these people could very well miss out on the medical care they need. So then, how do we flatten this curve? Well, let's take countries who have been able to dramatically curtail new cases. Places like Singapore, South Korea, Hong Kong, Taiwan, and even China have curtailed new cases dramatically. And then compare them to countries like Italy and Spain, where it has spiralled out of control. The difference? Well, those places who have demonstrated a capacity to limit the spread of coronavirus have all enacted strict isolation policies. Remember how it takes on average about 5 days to show symptoms, and how we can be contagious before we even show them? Well, if everyone obeyed strict isolation orders, this thing could burn itself out in a matter of weeks. For starters, if you start to get symptoms of a cold like a runny nose or a sore throat, for God's sake, stay home and self-isolate, especially if you are otherwise well without a condition like diabetes. Otherwise, attend a drive-through clinic, because if you didn't have coronavirus before attending a screening clinic or a medical clinic, you probably would afterwards. You see, if I wanted to catch coronavirus, I would find a group of people who probably already have it, and I'd hang out with them for several hours. In other words, I would go to a screening clinic or a doctor's surgery. One report of 138 patients in China estimated that 43% of them actually acquired it within the hospital setting. So if you think you're ill, isolate yourself. Don't go to your doctor and potentially catch it if you don't already have it, or even worse, spread it around if you do. By all means, if you are genuinely ill, as in I need oxygen to breathe kind of ill, then get help. But it sure would be great if you could call ahead to help with planning. And if you're not sick, you still need to isolate. When in public, stay at least 2 meters away from other people. And if you are in an indoor environment with air conditioning, such as on a bus, that distance probably needs to be even greater. In fact, there have been documented cases of transmission of COVID-19 of about 4.5 meters or 15 feet on a public bus. Ideally, avoid public transport altogether. And if you need to exercise, swap the gym for a home workout or an outdoor sojourn. The virus which causes COVID-19 can also remain virulent on various surfaces for prolonged periods. For example, it can stay on copper for about 4 hours, cardboard for up to 24 hours, and 2 to 3 days on plastic or stainless steel. This means if you touch a contaminated surface within this period of time and then touch your face, you are at risk of infection. And the problem is, we touch our faces a lot more than we realise, with one study finding that medical students touch their faces, on average, 23 times every hour. So then, while the respiratory route is the main route of spread of COVID-19, we should ensure we keep surfaces clean, especially things such as light switches, handles and doorknobs, which are touched frequently. Fortunately, coronavirus is pretty fragile as far as pathogens go, having an envelope which is quite susceptible to a variety of disinfectants, including alcohol, ammonium products and bleach. In fact, one systematic review of studies on coronaviruses showed that various disinfectants inactivated a number of coronaviruses within 1 minute, though the strain that specifically causes COVID-19 was not tested. But if you are using some of these products on your hands, such as alcohol sanitizer, be sure to let them air dry, because that will make them more effective. Convenience aside, nothing beats a proper hand wash. Unfortunately, this is often performed poorly, even by doctors. And just to note, it really does matter whether you use warm or cold water. Warmer water is much more effective at removing oils which harbour microbes. And also consider for a moment that the virus causing COVID-19 has been detected in faeces. So toilet paper shortage aside, wash your hands properly. And then the question arises, should you wear a surgical mask? And the answer is, only if you're coughing or sneezing. You see, surgical masks are not worn to protect the surgeon from an infection, but rather prevent pathogens entering the surgical site if the surgeon coughs or sneezes. And they do this quite effectively. These pictures are of a surgeon who was encouraged to sneeze by inhaling finely ground pepper. You can see in the picture on the left when he's not wearing a mask, there's quite a widespread dispersion of droplets, and on the right, the mask effectively contains these. Surgical masks, however, don't prevent you from inhaling droplets, and for that you need what we call an N95 respirator mask, which fits tightly to the face, at least ideally. You see, getting a near airtight seal is tricky. even for people who wear them all the time, and incorrectly worn, one of these masks will simply give you a false sense of security, and they are also in very short supply. So you should probably leave them for those who really need them, the health professionals on the front line. So let's now change tact. And it's very possible that despite your best attempts at isolation, you may still contract coronavirus, in which case you should try and reduce the severity of illness. Now, one of the most common symptoms of COVID-19 is fever, which means, at least if you are following NHS advice, you may be tempted to take paracetamol or ibuprofen. This advice, however, is probably not prudent. The French government, in fact, is explicitly recommending that anti-inflammatory medications like ibuprofen, commonly known as Nurofen or Tylenol, not be used to manage fever in cases of coronavirus. First of all, fever is a part of the innate immune response which enhances the ability of the body to clear viruses. So ibuprofen, which reduces fever, likely interferes with immunity. And ibuprofen also increases the expression of angiotensin-converting enzyme 2, which is how coronavirus infects our cells. So it's probably prudent to avoid taking ibuprofen. And for that matter, I would also avoid taking paracetamol as well, unless under the specific advice of a doctor, because paracetamol has also been shown to impair the immune system, as evidenced by impaired immune responses to vaccines, and some studies finding increased infection risks in hospitalised patients when they get given regular paracetamol. And there are also other drugs which cause an increase in angiotensin-converting enzyme 2, these being angiotensin-converting enzyme inhibitors, angiotensin receptor blockers, and diabetic medications called glitazones. Unfortunately, there's not yet clear evidence on whether or not this poses a real risk with regards to coronavirus, and expert recommendations appear contradictory. My perspective is that there are safe alternative medications, then out of an abundance of caution, I would change to those medications for the time being. And sleep deprivation has also been shown to significantly suppress the immune system, and not just for healthcare workers, but also for patients in hospitals. Research has repeatedly shown that sleep deprivation impairs functioning of the immune system. For instance, the activity of natural killer cells, which is one of the first-line defences against viral infections, is significantly suppressed. We also see this with impaired immune system response to vaccines, which has been repeatedly shown in research. And also, susceptibility to viral infection has been proven. In this study, 153 healthy men and women had their sleep monitored for 14 days, after which they were quarantined and administered nasal drops containing rhinovirus. And those who were getting less than 7 hours sleep were 3 times more likely to develop illness compared to those getting more than 8 hours. The message? Sleep. And then we get to exercise. Exercise undoubtedly is good for the immune system. Exercise, in fact, has been shown to be associated with a reduced risk of viral infection and improved functioning of the immune system. And contrary to popular belief, vigorous exercise does not necessarily lead to a period of immune suppression. So regular exercise, though not necessarily exhaustive exercise, for instance a marathon, is absolutely recommended if it's medically appropriate. Obviously, avoid going to the gym, but there's lots of exercises you can do at home. Evidence also suggests that diabetes may increase the risk for infection from COVID by 2 to 3 times, independent of other medical problems such as heart disease. And this is consistent with the H1N1 pandemic in 2009, where diabetes was basically shown to double the risk of dying. And this makes sense because unstable blood glucose levels impair the functioning of the immune system in a number of ways. The key thing here is that a diabetic with controlled blood sugar levels is very, very different to somebody with poor control. Immune function can be rapidly and dramatically improved if you can obtain stable blood sugar levels. So rather than stocking up on comfort foods and candies, now is probably the time to take control of your blood sugar levels more seriously than ever before. And this also applies to non-diabetics who may be either pre-diabetic or have metabolic syndrome. Your immune system will function much better without spiking blood sugar levels. So to finish, please know that this is not the boy who cried wolf. This is the wolf. The time to act is now. Isolate yourselves to save others. We live in a community. It's time to act like it. Selfish, entitled behaviour will only lead to unnecessary deaths. Thank you.